episode of The Science Behind Humans. I am Alana, your host for today, and we're going to be discussing the state of women's health. For today's conversation, we have two guests that are joining us. So Dr. Kristy, she is a medical doctor, OBGYN, that specializes in functional medicine. Hi, Dr. Kristy.
Hi, thanks for having me.
And we have Abida Dhukai. She's a nurse practitioner with a PhD in cardiovascular disease and exercise physiology. Welcome, Abida.
Thank you.
Okay, so let's get started with this podcast. Dr. Kristy, could you please explain what is functional medicine?
Yeah, so functional medicine is an approach to medicine that is really going back to basic medical physiology, for starters. It is evidence-based, but it's looking at the human body more in a holistic manner. So mind, body, spirit aspect of healing, and really getting at the root cause of issues and really understanding sort of the very basics and foundational layers that are missing or required for healing.
Would you mind me asking what's the difference between functional and traditional medicine?
Yeah, traditional medicine, we tend to be very siloed in our approach. So for example, myself as a gynecologist, right, I would be very focused on the ovaries, the uterus, the cervix, the vagina, you name it. Whereas now as a functional medicine specialist, it's just not about the hormones, but rather I'm a gynecologist that's talking about brain neurotransmitters and gastrointestinal tract. And so it's just a much more expansive way versus a siloed approach that we typically look at things through the conventional medical lens.
Okay, so with the focus of today being on women's health, how do you see the integrated approach for women's hormone health being managed across all ages?
Yeah, so it's interesting that the age spectrum certainly is one thing because different imbalances will show up at different stages in women's reproductive careers, but at the foundation of it all is just really understanding the individual's changes and imbalances in hormones. So what may happen in our 20s may be a different pattern than we see in our 40s and certainly than most postmenopausally. So understanding what an individual's levels are helps to determine the management.
Could you tell us a little bit about the benefits of using HRT and other modalities for menopause?
Yeah, so hormone replacement therapy is just a means of replacing somebody's hormone levels. And the idea and the objective is to return somebody to a physiologic range and achieve balance between hormones. Every hormones tend to have a pair. So estrogen, for example, would go with progesterone. And so, replacing those hormones with a bioidentical version, ideally, and that just basically means a hormone that matches what our human hormone looks like, means that the body can also break down that hormone into byproducts that the body can get rid of. And so that's certainly one aspect of management of hormones, but it's not the only one. And you can also use other supplements to other support sort of basic building blocks that are needed for the body to optimally function, or can use herbal remedies to balance hormones as well if there's a subtle underlying issue.
So I'd like to address what your approach would look like for the root causes of menopause.
Yeah. So with a functional medicine approach, it is looking at the mind, body, spirit aspect of health. And so you have to understand the bigger picture of what's going on for somebody. So it always starts with a really good history and understanding what they're presenting with and whatnot. But then when you get to the investigative side of things, there's a lot of different ways that can be explored to better understand what's happening. So for example, with hormones, yes, you can use serum, you can use urine as well to get the hormone levels and the metabolites of them. You can look in serum at micronutrient testing, so things like your vitamin C and magnesium and B vitamins and whatnot. So it's really targeting and tailoring your investigations to the individual's symptoms to better understand what their physiology is all about and what state of affairs their hormone and micronutrient status is.
Perfect. Thank you for sharing that. That's a great introduction. So I'd like to move on to Abida. Abida, would you mind sharing your background and what you do or how you service patients on a daily basis?
Well, I see a lot of patients who come to Science and Humans who are looking for some idea of why they're having some of the symptoms they are. A lot of women present with, we've gained weight, I'm having trouble sleeping, I've got a lot of brain fog, I'm having joint aches and pains. They'll say, I'm having, very significant mood disturbances, and the relationships with partners and significant others has become quite strained. And so when we do blood work, we look at where their hormones are. We look at other issues in terms of, are they doing things to help with their own mental health? Are they exercising? Are they getting enough sleep? And if they're not getting enough sleep, and if the sleep disturbance is because of a hormonal imbalance, we'll help them that way. We also look at how else, with the hormones and exercise and other mental health strategies to help these women.
So when it comes to science and humans, what would you say are the unique offerings that we can provide?
So I think one of the biggest benefits of Science and Humans is actually we're able to provide care using a virtual platform. So meet people where they are. We're able to access individuals who necessarily don't have primary care easily available to them, who are struggling because they've lost their primary care provider. We also see a lot of people who, sometimes won't feel comfortable disclosing these things to their primary care provider, or who have seen their primary care provider and have, unfortunately been dismissed. A lot of women come to us and say, my family doctor says, oh, just deal with it. Welcome to menopause. And, you're going to suffer for the next 10 years, but don't offer any other strategies that are quite evidence-based, right? The treatments we do provide are evidence-based, show that there's a lot of improvement in people's symptoms and return to their sort of previous state. That I think that's one of the benefits that we have.
Would you say that our typical female patient is already aware that they're going through menopause, or is that somewhat of a journey that we have to take them through?
So I think the benefit of social media, a lot of women are seeing these things on social media popping up and saying, wait a second, I relate to that. Yeah, actually, that's happening to me. And so they start searching, and they're quite proactive in advocating for themselves. And so I think they come to us because they've seen something that relates to what they're going through. And then when they see us, we can help them figure out if that's exactly what's happening. We're having a lot of younger women coming to us and saying, hey, listen, I'm having some of these symptoms. And then we do their testing, and if everything looks okay, then we look at other reasons for why their symptoms are off, right? It's are they in a really stressful sort of situation, right? Are they having family issues? Are they not sleeping? Is their work really, really stressful? And so we're able to look at other things that could also be the reasons why they're having some of the symptoms there.
So Abida, when it comes to menopausal approach, what is the importance of a patient-centered care approach?
So I think it's key, right? So to understand what each individual's going through, seeing, if there's biochemical reasons for how they're feeling, looking at other issues that are pertaining to their life that could impact how they're feeling. So, are they making sure that they're exercising? Are they sure that they're eating well? Because those are foundations, I think, for wellness that I think we tend to forget, right? When we get busy, it's what's the first thing that gets out of, stop exercising, stop eating well. You try to grab whatever's convenient, easy, and then looking at, other reasons, right? Are they taking care of themselves? Dr. Kristy talks also very importantly about the importance of nutrients and macronutrients, micronutrients, and deficiencies that could be contribute to that. And what we do at Science and Humans is try to develop a very unique plan for people who come to us looking for help, and because one size doesn't fit all for all care, right? And so we've got to remember that.
Yeah. And I think, certainly the way the world is changing, patients are increasingly wanting to be involved in their care, as they should be. So, one of the roles as a practitioner is really to educate our patients and provide them with the information and science to help them make decisions for themselves, because they're obviously the ones that have their best interests at heart.
Let's talk about the gaps in conventional medicine when it comes to the approach of hormone health. What gaps have you seen either in your practice or with the patients on a daily basis?
For me, the biggest gap was the one that I actually personally fell into, and that is burnout and the physiologic consequences of chronic stress. And it was one of those situations where, physician heal thyself, and I couldn't figure out what was going on with me. And so really key that I started to look at things differently and with a different approach. And that's all around the hormone cortisol. That's our stress hormone. And because it's a foundational hormone, if that one is dysregulated, it touches every other hormone, every other system. And, so the tendency in conventional medical model is to look at the extremes of disease, Addison's and Cushing's. Now, fortunately, I didn't have that, but it didn't mean that I wasn't having issues and was struggling. And it was things like fatigue and, foggy thinking, irritability, those sorts of things that we can excuse away as just being stress related. But the reality is that there is a physiologic consequence there. So once that can be identified and understand that there is a pattern of disease, that can be a really helpful understanding to get patients feeling better. As I say, it's at the foundation of it all. So if you don't get that one figured out, you're not going to have the impact that you need on the other systems.
So I'd like to talk about what you would say is the best approach when it comes to mental health and emotional well-being during menopause.
Yeah, I think it still comes down to, a really good history and understanding when somebody is having their experiences. I mean, if you've got somebody that has never had any mental health issues and yet are showing up in their late 40s where things, overwhelm and just not coping as well as they're used to coping, anxiety, depression. If it's a new onset, then it certainly questions what's at the root of it. And oftentimes in our late 40s, there's a bit of a perfect storm that's happening. Our hormones are changing and fluctuating all over the place. At the same time is the cortisol piece of it, life catching up with us, sort of intersect. And that's where you start to see a lot of health issues and mental health issues specifically that can be sometimes even mislabeled as mental health issues when really the underlying is the physiologic consequence to changing cortisol levels and changing estrogen and progesterone levels.
So I think in our previous conversations, one of the biggest takeaways that I've had is lifestyle changes. Personally, I've worked to at least get close to my 10,000 steps a day. I'm eating cleaner, whole foods. Are there any other lifestyle changes that maybe before we go into medical approach you'd suggest making, and then if needed the medical approach, how do we tie that all in?
Yeah, so I think as far as lifestyle changes go, the other big category is sleep hygiene and actually really looking after the environment that we're sleeping in. And because while we're sleeping is when we're regenerating a lot of these hormones, so having the temperature in the room cooled down, having blackout blinds or whatever it is to get a nice environment, getting enough sleep, getting sound and solid sleep. It ties into the whole circadian rhythm and illumination. So during the daytime, what you do during the daytime actually will impact your sleep as well. So for example, getting up at sunrise and looking directly into the sun gives you a spectrum of light, particularly blue light, that is helpful to reset a circadian rhythm. And then that blue light later on in the day can be disruptive. So wearing blue blockers or, no screen time for 3 or 4 hours before going to bed is another, important way. So that gets into the whole category of malillumination. And, we could talk about electromagnetic radiation, and there's all sorts of different avenues that one could go. But, that's sort of the physical body aspect of it. Then there's the emotional well-being. And I think a lot of times as women, we can sometimes get caught up in trying to control the things that we really can't control. And so if you're investing a lot of energy trying to, change things that doesn't matter how much you worry about it or how much effort you put into it, the outcome is going to be the same. Well, that's a really good thing to let go. And men are very good at doing that. They're very good at compartmentalizing things. Women, I think, are a little bit more complicated than that in another beautiful way. As nice as it is for men to be compartmentalized and put things in its place, I think women also experience the world in a different way for being a little bit more complicated, and there's beauty in that as well. But if we can distinguish between the things that we can and cannot control, I think that goes a long way in taking the pressure off the system. And one final thought on that too is, we tend to normalize our stress. And, we can say things like, well, I've always done it that way, or, so-and-so next door is doing it that way. Why am I no longer able to do it? Why am I not keeping up in the way? Why am I overwhelmed? Why am I fatigued? Why am I, not sleeping as well? Why am I, feeling anxious? Oftentimes there's, we just don't see stress for what it is, that there is actually a physiologic consequence and that it does eventually catch up with us if we don't make wise choices.
I think the way that the culture is currently set up does end up affecting us on a daily basis. I know that women will go through at least one hormone imbalance during their life, and the biggest one being menopause. So how does Science and Humans help empower patients as they go through a hormonal imbalance such as menopause?
So I think being open and being available at times that are, they're available for patients to come and see us. I think it also gives them a platform to talk about what they're going through, and speaking to somebody who is focused on not only dealing with their hormones, but other sort of more holistic parts of their care. I think in providing them with validation for how they're feeling. We talk about, sleep. We talk about well-being. We talk about mental health. Provide them with strategies on, how to optimize that. If we have to refer them to therapy or psychiatry, happy to do that if that's something that they need. I think we also provide them with sort of evidence of saying, yeah, actually, this is how we're going to treat you because this is what the evidence is. And so, what we're doing is not something that hasn't been proven.
So with the awareness and the education that Science and Humans is looking to provide to not only our patients, but female patients across Canada, US, UK, anywhere in the world, how do you think women's health is going to change in the future?
I think women have become huge advocates for themselves. And considering that women weren't included in research studies until the early 1990s it's quite profound how far we've come. And I think advocacy and so a lot of women coming to their primary care providers or specialists and saying, hey, listen, I'm having this issue. Would that then help validate and increase curiosity and look at, will this help generate even more research for women? I think as women transition from the perimenopause to menopause transition and sort of see how things change and how they're optimizing their care, I think that message will go out. I think women are great advocates for themselves. They'll message with their girlfriend groups or their close colleagues and say, hey, listen, yeah, I'm having this, but this is what I've done, and sort of being support for each other, I think.
I want to jump back into everything you're saying, because I think that ever since I started learning more about menopause and hormone health in general, every single time I have the opportunity to speak to somebody about what I do, what we do in the space, the conversations that I've had, I believe that women are the first to jump into oh, I'm interested in that, and oh, I want to learn more. I'd like to tie this back into the most common question I get is, what can I do on a daily basis to help support my symptoms as I go along? And then when is it time for me to seek treatment?
Well, I think always having sort of a baseline understanding of what you are when you're at your healthiest is a good benchmark to aim for when things are not optimal.
And so when you say you're healthiest, is there a specific age that you'd recommend you start keeping track of your hormones?
I wouldn't necessarily say it's an age-related, but generally speaking, right, in our 20s, we oftentimes feel at our best. But, having said that, we're seeing the next generation come along, and we're seeing that hormonal issues are really impacting our youth as well, right? We're looking at diabetes epidemic, hypothyroidism being an issue, cortisol dysregulation a piece of it. So, I think that may differ from generation to generation, but it is always helpful, but not necessarily part of how we approach things in conventional medicine is, what did you feel like when you were feeling at your best?
Taking advantage that you're here, you're on the practitioner side. How can practitioners make menopausal awareness or menopausal healthcare more accessible and affordable to women?
I think being educated on these transitions in life, I think that's key. I think as more people sort of take advantage of conference opportunities in reading new research on hormonal health, or looking at data in a bit of a different lens, saying, okay, well, women are having more heart attacks and heart disease and stroke as they get older. Well, yeah, it makes sense because estrogen is declining, progesterone declining, which are very cardioprotective, right? Dementia is coming up. So I think as providers start seeing this more and more, then they should start digging further and seeing, hey, is there evidence to support this? And if there isn't, engage in it. I think, that's really, really key to be at the forefront of women's care. I think in terms of affordability, I think as more and more providers provide this care, I think then, private insurance companies will start saying, oh, wait a second, there's actually a benefit in providing care for our clients. And if we help them with these treatments, will prevent further downstream health consequences. And I think that's also important.
So to go back into lifestyle changes and adaptations that we had discussed, you mentioned the importance of sleep, but earlier before you mentioned you're fasting. So could you tell us a little bit about that?
So, dietary changes is a big part of lifestyle modifications, and it is about absolutely what you put in your mouth, whether it be on a macronutrient level or a micronutrient level, but also the timing of when you eat can be very important. And so intermittent fasting is certainly one way where it's, a restricted time within which you eat your calories for the day. So it doesn't necessarily mean that it's about caloric restriction, it's about condensing the amount of time. And depending on how long you fast, you get very different results. As far as, when the body starts to heal itself, we start to see changes at 15 hours, at 17 hours, at 36 hours. So really depending on what your objective is, intermittent fasting can be a very good way of getting the body back on track. It's not necessarily for everybody. When somebody has a cortisol dysregulation or chronic stress, the body will see it as yet additional stressors. So you really want to make sure that you've optimized a lot of your foundation before you start on an intermittent fasting journey.
So we're reaching the end of the show, and I think it's important to address the women that are watching from home who are either going through menopause or are interested in learning more about what their bodies might be going through or will go through. Are there any suggestions, aside from the ones we've already spoken, about how they could potentially address their symptoms at home?
So I think sort of talking to other women and, seeing what other people are going through. I think researching, there's a lot of evidence out there and there's a lot of research out there, and making sure it's in a good source of research, and sort of understanding, are they also taking care of themselves, exercising, eating well, sleeping well, taking care of their mental health. And then if they're interested, they always can reach out to their healthcare provider or other providers like Science and Humans to see, get an understanding of where their hormones are. If they don't have any symptoms, great. But getting a baseline is wonderful. But then if you're starting to notice things are changing, there's no harm in approaching a provider and to see if there actually is something that can be done to correct some of the symptoms they're having.
Perfect. Well, I appreciate that. Thank you for your time. Thank you, Abida. Thank you, Dr. Kristy, for hopping onto the show, and we'll see you next time.